Anderson Cooper, AC 360, CNN weeknights 10 Eastern.
And tonight, we're on the medical money trail, where some closely kept secrets are finally coming to light. You know, it's a corner of medicine that until recently has operated almost entirely in the shadows. So let me start with asking a couple of questions. When your doctor prescribes a medication, how can you be sure that she or he isn't being paid by a drug company to promote that drug? And if he was, would that make you think twice about taking it? Would it make you wonder if that drug, the one he or she was being paid to promote, was really the best drug to treat you? You know, it's been said by many that a doctor's prescription pad is one of the most expensive instruments in medicine. After all, it's the prescriptions doctors write that decide the medications, the tests, and other treatments that patients get. I want to show you a number, an important one now, $300 billion. That represents what pharmaceutical sales were in 2009, according to IMS. That's a company that tracks the industry. IMS says that's about 5% more, incidentally, than in 2008. Now, it's not news that drug companies spend a lot of money to advertise and market their products, but keeping them honest, it turns out that some of the biggest drug companies are also paying a lot of money to doctors to talk about their drugs to other doctors. The drug companies and many doctors who give these talks call it education, and some say it can improve patient care by keeping doctors up to date on the latest research and treatments. Critics call it marketing, pure and simple, or even worse than that, they call it bribery, an attempt to influence the prescriptions doctors write. Now, we should point out that these payments, they're perfectly legal, and under federal law, drug companies aren't required to disclose these payments. That's going to change starting in 2013 under the new health care law. In the meantime, some states do require disclosures. Just this week, in fact, Massachusetts made these payments that we're talking about public. But there's also a database now that's getting a lot of attention. It was created by journalists at ProPublica. As an interesting database, it really focuses on these 7 drug companies. They've disclosed how much they pay doctors. All but 2, according to ProPublica, were forced to make this information public as part of settlements and fraud cases. Now, keep in mind, these 7 companies are just a fraction of all the drug companies. Keep that in mind as you look at some of the numbers now. What they found specifically is that ProPublica found that $282 million were paid to more than 17,000 doctors in 2009-2010. $282 million. Now, if you break that down a little bit, you find that to any particular doctor, they could really vary quite widely, from $100, a small number, to more than $300,000. $300,000 to a single doctor. Break it down even a little bit more. 384 doctors received greater than $100,000, and 43 of these doctors received more than $200,000. Now, these payments, to say the least, they are controversial. Question is, are they really an effort to control your doctor's pens? And that's the real question here. Coming back to the pen, what's the influence here? Are the drug companies right in maintaining that they are simply improving patient care?